Hello and welcome to the CITE View on Asake Online. My name is Leslie Moyo. In today's edition of the program, we are joined by representatives of the Zimbabwe Alzheimer's and Related Disorders Association, and we're discussing about dementia as well as Alzheimer's. September is recognized worldwide as the Alzheimer's Month, and this is so that they raise awareness, fight stigma, as well as offer support to those who are suffering from dementia. So I'm joined in this program by Ms. Geraldine Young, who is the administrator of the association, as well as Mrs. Swanile Chinara and Ms. Jane Morose, who are in the training and counseling department. Thank you so much for taking time to join us.
Thank you for having us.
So maybe let's start by you explaining what Alzheimer's disease is and how it affects individuals as well as families.
Okay, so it's a disorder that affects the brain. It's generally in the elderly, but they did a study during COVID in 2020, and they've discovered it affects children as well. Obviously, of late, our main concern is the elderly. I'm sure Jane will continue on that score. And basically, we just need to raise awareness that it is a disease. It is not witchcraft. There's stigma across the board with regards to this.
Yes. And what are some of the related disorders that you also look at?
Okay, so dementia is actually the umbrella word, and Alzheimer's is actually one of the diseases under that umbrella of dementia. We also have what's called Lewy bodies dementia. We also have vascular dementia. There's also Korsakoff's disease. Korsakoff's disease comes about from the abuse of alcohol. There's a number of others. I can't remember at this stage.
And how prevalent is Alzheimer's? I ask because I think people, when they come across such cases, they'll say whether it's witchcraft or it's something else, but they can't really tell that it's a condition or a disease that is affecting people.
Yeah. I think we've noticed since COVID especially that it's definitely on the increase. Even during COVID, we had some elderly people that went walkabout, and some of them fortunately were found, but sadly some of them weren't. And I think that whole situation has brought out, I think, in some ways more awareness of mental issues, but we need to stem the stigma that goes with it.
Yeah, the statistics, if I can jump in.
Yes.
In 2019, those are the current statistics we have in Zimbabwe, which shows that 27,000 people have dementia. In that, it's predicted that by 2050, 80,000 will have. Actually, they're saying that every 3 minutes, someone is diagnosed with dementia. So it is a real public health crisis, which we need to be looking at and seeing how we can apply some preventive measures.
Maybe let's pick it up from there. What are some of the preventive measures that you feel maybe, because you bring stats, and obviously when numbers are mentioned, people tend to try and quantify that, and 27,000, I think it's a big number. Yeah, so maybe what are some of the interventions that maybe you feel you need to start working on?
It's just basically a healthy lifestyle, because some of the risk factors are excessive alcohol consumption. We are a world which likes our alcohol, but excessive alcohol consumption always affects the brain. So because this is a disease which is a progressive degenerative brain disease, so excessive alcohol affects the brain. So is to just make sure your lifestyle is that way. Diabetes is one of them. Uncontrolled diabetes, I must say. so that not everyone thinks once I have diabetes, I might have dementia. It's uncontrolled if it's not under control. And I think she mentioned the alcohol. And then there is just physical inactivity, or physical, and also if you are not using your brain, the brain cells are dying. So there has to be cognitive stimulation all the time, especially as we get older. You know how sometimes they say, older people, sit down, don't do this. You're old, you don't have. But actually, to prevent dementia, we have to learn something every day. Even in our 90s, we're not saying go and write an exam, but stimulate your brain to learn something every day. It keeps the brain cells, they say neuroplasticity, which means that the brain continues to create new cells instead of just deteriorating and dying.
Mm-hmm. And maybe let's come to, I know Charlene spoke a bit about misconceptions, about stigma. Maybe let's discuss that for a bit, the misconceptions that you've come across around Alzheimer's in Zimbabwe.
Yeah, the biggest one in Zimbabwe, we have the recent Gogo in Gulumane,
yes,
who was picked up. Yes. It is witchcraft. Because people are not aware what dementia is about. That's why we are bringing awareness. Is that they think it's spiritual. It's witchcraft. This Gogo or Kulu must have dabbled in witchcraft before, and they don't realize that it is actually a disease. So that is the main misconception, or just the devil is someone is possessed by spirits. That is the biggest one that we have to deal with in Zimbabwe, and not only Zimbabwe, even in the other countries.
But I'm sure the negative impact of that is that it tends to lead to abuse. Obviously, we saw the video of that lady that I think she was beaten up, and people were saying all sorts of things. Yeah, I'm sure maybe you've come across such cases where maybe even from within families where it ends up leading to abuse because they don't know how to handle.
Because people don't know how to deal with the situation. Sometimes the abuse actually is the caregiver trying to cope as well. Because when a person is affected, affects the caregiver even more sometimes. Because the patient doesn't actually sometimes is not aware of what's happening. But the caregiver, because they understand everything, the abuse can come from trying to protect that person, lock the person away, and not take them out, or they're in this embarrassment because of the condition. So that's a form of abuse, because the person wants to go out, and experience the world. They still a person. It's just that the memory is affected, and they are not able to think cognitively like any other person or process things. So that the abuse can come from that, and just people not understanding. Was because it takes a lot of patience to deal with a dementia patient. They keep asking you the same question over again because they can't remember what they told you. So people get short-tempered and they can abuse them, shout at them, even beating them up because they now are not able to do the things. They mess themselves. They're dealing with incontinence. People, beat them up. They think they're doing it purposely. So the abuse can come in that way as well, not where the blatant way, where we see people, they think it's a witch, they know how to beat them up. So.
And you mentioned loss of memory. What are the other symptoms that maybe that's showing early, so that maybe people can be aware in terms of in case they encounter such cases in their families?
Sometimes restlessness, depending on their stages, because like as we said, it's a progressive disease. It keeps progressing from the first stage, second stage to final stages until they even die. They live with it. So depending on their stages, I'll just give simple examples. They get forgetful. They can't remember days, dates, and nights. They can't tell the difference between day and night. Sometimes at daytime, it will tend to be at nighttime. They can sleep all day. Then they keep awake all night. They can wander around at nighttime. like as if it's a normal daytime. They want to do the normal day activities at night, which is whereby so sometimes they are now found wandering around naked because they've gone to bed, but just decided now I've got to go and start ABCD, normal day-to-day life activities. Then there's also those signs of, with the progress of forgetfulness, they can't remember how to go to the toilet, which can be a very painful part sometimes. In the second stages, they mess themselves. They can't tell exactly what to do. The mind will not coordinate where to do it, how to do it, which is the most embarrassing part of it if they are in a family setup, which there again, abuse can come in. This is silent abuse in families, which is very common. It's done through ignorance. And that's where we as ZARDA intervene by training the carers, training the primary carers, the families, any close people who are close to them, to say, this is how you handle them.
My next question was going to be on intervention and how the ZARDA comes in, because you were mentioning that, you know, most of the caregivers are family members who are given the responsibility to take care of the elderly within their families who are dementia patients. But maybe besides training, maybe you can expand a bit upon on the training, what type of training you offer, and what other interventions that you also come in with in terms of assisting dementia patients and their families.
We as ZARDA, we do help and assist by counseling the families. In the area of counseling the families, it assists to let them know what is expected of them and what they had to expect from the affected, who is a family member. Then secondly, we advise them on what steps to take on how to manage the condition from home. As we all know, it's not a hospital case. They don't get admitted in hospital for that. Yes, they can be admitted for other ailments, medical ailments, but when it comes to that part, this is a home care. So we train the caregivers, people who can be able to manage these conditions from home. Sometimes even the family members. If we train family members, it helps in the sense that they can identify what is happening with the person at home and take the right way on how to manage them. Either taking them to the doctor in the right time, whereby, so we always say, if they are diagnosed earlier, sometimes symptoms can be withdrawn. So this is how we intervene as ZARDA. And we also do visit their homes. Once they've been identified, we do a follow-up. We go to their homes, check the environment to see, is it supportive? If not, we do advise how they can manage them, either removing them from the family setup or keeping them there, but applying the right methods of management.
And what sort of support do they need, maybe either from the communities or from their family members?
I'll go back to raising awareness. The more the people know and understand about this, the better, because it means when we get one person from a community to come to the training, they go back, they can now help the other community members in the neighborhood. And then, apart from that, if a family member understands and knows what is happening in their environment, it's going to save the whole community. Because it means people will not be left to wander around, people will not be abused. One person knowing and seeing will tell the next person, That's the best way we are trying to do it present.
And is it something that can be treated, Charlene?
As we said, I think Sibonile said, or Jane touched on it as well. Unfortunately, it is a degenerative disease. So basically, it's from diagnosis to death. There are different stages, as Jane mentioned, and through the help of the doctors, They do and can. Not everyone is the same. That's the other thing. It's very individual. So there is what we call like an aggressive period that they can go through. And during that aggressive period, it might be necessary to get the doctor to give medical intervention in the form of tranquilizers in order to keep them calm, to stop them hurting themselves and hurting other people. But the whole thing, as Jane mentioned, is actually management of the disease. My mom had it, and some of these things you land up learning the hard way. As much as you want them to remember, there's no point in keep saying to them, but I just told you, because they don't understand and they don't realize. And confrontation is the worst thing you can do. Do not confront. The best thing is to, distract them. Say, let's not worry about that. Can we go and do this now? And how about doing this? And what did you do at school in your day? And things like that. And that is the best way around it.
And then in terms of the healthcare system that we have in our country, do you have like structures that actually, or do you have adequate infrastructure that helps us in terms of identifying, diagnosing the disease, and maybe offering support, or it's left to associations like ZARDA and maybe other like-minded organizations that are helping?
Yeah, I think it's basically left to us, or the likes of us. We are a private voluntary organization. We have finally been registered with the Ministry of Health, but it took 25 years in order to get that done. In Bulawayo, we're relatively new because I started it when my mum got it. One of our biggest issues is funding. At this stage, we offer a membership, which is $20 a year, and Ministry of Health expects us to have like a membership. That's what they look at. Which, when you're dealing with a disease like this, where people are passing away, it's a bit difficult because families, they might be with you along, for the journey, and then after that they stop. And at this stage, we desperately in Bulawayo need some kind of office, a base where we can be continually, because that is the request that we often get. Where can we find you? Most of us that are involved in the association are volunteers. We're not paid for what we do, and which then means we have to fundraise. And unless you've got a really good, vibrant team, that's also something that can be quite a challenge, especially in the economy at the moment. The other thing that we are looking at, or we would love to have, is a corporate sponsor, someone that could come on board, with us and help with organizing an office, and for us to have someone to man that office, Monday to Friday, even if it's only a couple of hours in the day. Initially as well, one of things on our wish list is to have a home of our own, because there used to be a number of places prior to independence. In fact, one of them was still after independence, but those homes have been taken. The one in particular that I'm mentioning is the one at UBH, which was taken to be a COVID hospital, and now it's been turned into a private wing of UBH. The other one was the Nervous Disorders Hospital. That would also be a place where we could put dementia people, especially if they were going through that difficult stage. But at the moment, there's no place like that.
Wow, interesting. But maybe for someone who is suspecting that maybe their relative may have dementia, what's the starting point? How do they approach this? Who do they go to?
The first thing they have to do is take the person to the doctor, to their general practitioner, and get a diagnosis that it is definitely dementia. Because I think you have to iron out hearing problems and also visual problems, but especially hearing. Often if a person can't hear and you keep talking to them and they're not hearing you, and then they keep asking you the same sort of things, there's a bit of a fine line there. So you've got to, iron that out. Once that has been established, the family could then come to us and then ask us. We have a questionnaire where we do assessments and referrals, and we can actually look at the environment in which the person is living, and we can give suggestions on what would be the best way forward for them and their circumstances.
Then looking at the month of September, obviously you did mention that you're raising awareness. Do you have any other activities that you're doing, maybe in terms of maybe fundraising, or getting just communities involved?
Yeah, so one of the areas that we started a couple of years back was Slipper Flip Flop Day, so that we run at the schools, because it's important to tell children about how important your lifestyle is. So we try and do that in and around the 21st of September. We've had a few schools that have participated this year. I'm still waiting to hear on others. We've had talks on the radio. We're doing this one now. We haven't done it this year, but we normally do a memory walk. We have one in Harare every year, but they've got like an established place where they walk every week. Unfortunately, we haven't got that sort of set up here in Bulawayo. And then they have that walk, and then they just make it, the memory walk. The memory walk is actually commemorated all over the world on the 21st of September. The other thing we have done here is we have support groups, and then we've been sharing information within the support groups, and wherever we can.
Then maybe in terms of messages of hope, what's that one message that you want to impart to communities to take to heart?
I would say, please, if you have a gogo or a kulu in your family and you have this kind of problem, please reach out for help. Do not struggle on your own. We are here to help. And also to please come on board with us, volunteer with us, and if you know of anyone that might want to sponsor us, we would be most grateful.
All right. Maybe in terms of how do people reach out to you? Do you have like contact numbers, or maybe people can those want to either support or to come and volunteer?
Yes, we do have an online. So we do have numbers, like the posters we have. We've put all over the places, and there's numbers. We can contact one of us, maybe a couple of us. And we also have an Facebook page, which people can reach out to us. But obviously for the rural community, it is difficult for people who can't afford even data to contact us. That's why Sharon was saying we really need to have a physical presence where people can walk in and get that information. So for now, that's all we have, but we're available. Those numbers are available to be contacted. And
I was going to wrap up now, but you have said something that maybe I can just ask my last question. You touched on rural communities. Obviously, in urban settings, we are having challenges, ignorance, lack of information. But how is the situation maybe in rural communities that maybe you've interacted with?
Yeah,
we have made some interventions on training carers who come out from the rurals. As they come to us for their trainings, we give them contacts. They're spreading the word back. Presently, we are preparing to go to Cholocho. We have been to areas like Kwekwe, where we reached out to rural people from Gokwe and all sorts. So these are the things that we are doing to reach out to families who are in the rurals. We have also done some trainings in the peri-urban areas, locally here in Matebeleland, like Robert Snyoka, St. Peter's, Pumula, right out Kami rural areas. So those are the areas that we have since been to. But we wish to do more because we are finding the rural areas are where people are more ignorant. They don't get access to us. They don't get access to any online things. Like even now as we are talking, they might not even have a radio to listen to. So we want to do more physical reaching out to such places, to district offices, through the churches, and in so many any community gatherings that do take place where we can actually physically be there. We are needing funding. We really, really need support on that, because if we get enough funds, we'll be able to do more. We have had an example of a family who reached out to us through the radio in Binga. Then they had to come all the way from Binga to one of their family members in Nkulumani just to be close to us. We are happy we managed to reach out as my colleagues Bonile managed to cancel them. After the cancelling, that's then when we discovered that they were from Binga, but they got helped. They were very happy. They went for diagnosis. They now understood what was happening. We rearranged for them to have carers and how to reach out to us for further help and assistance on advice. So these are the things that we are doing, but we are so limited because of finances.
Well, thank you so much for taking time to come and discuss this very important issue with us and raise awareness. And I think also us as the media, I think we're also guilty in terms of failing to raise awareness. Because I remember when I read the story, there was the screaming headline that saying that the old lady in Kulumani was a witch and everything. So I think us also as the media, we also have an important part in terms of raising awareness. Hopefully this program will reach out to so many people and we'll see a change in terms of how we take care of our elderly and even young people who may have this particular condition. So thank you so much for joining us this morning.
Thank you for
having us. I hope you did learn something about dementia, about Alzheimer's, and you will take care of your members of the community, members of your family, and those that you interact with. So let's not rush to label someone a witch, a wizard, simply because they are suffering from a condition that you may not understand. So if you come across such kind of a person, please do help them by maybe taking them to the nearest police station or taking them to the nearest health facility. Also get in touch with members of ZARDA. They will be glad to assist you. Let's meet again in the next edition of the CITE View. My name is Leslie Moyo.
Thank you.